Welcome to the webinar on CoMiSS to raise the awareness of symptoms related to cow's milk allergy. My name is Anna Nowak-Wegrzyn. I'm Professor of Pediatrics at the NYU Grossman School of Medicine in New York. And I am moderating this webinar on behalf of the CoMiSS Expert Consensus Panel. We had a meeting earlier this year in June, and you can see that the panel is composed of many international experts in the field of food allergy, particularly experts in cow's milk protein allergy. The conclusions from the webinar one that you have watched already was the explanation why the diagnosis of cow's milk allergy is so challenging. And there are many reasons for that. One is that cow's milk allergy is among the most common food allergies globally. There are non-specific symptoms of cow's milk allergy that can overlap with other common childhood illnesses. And in particular, the non-Ig mediated cow's milk allergy is difficult to diagnose. And this is important because misdiagnosis, so both under and overdiagnosis, have negative consequences for nutrition, for quality of life. Therefore, there's a need for diagnostic tools that could improve awareness of the healthcare providers on the front line of allergy management. It should be noted that an awareness tool does not take away full clinical assessment and judgment, and then the range reduction and challenge has to occur to confirm the diagnosis. CoMiSS has been developed by the group of experts and has been validated in numerous studies, and guidelines have been published for healthcare providers on how to use these tools. Our speaker for today is Professor Yvan Vandenplas, who doesn't need much introduction. Let me just say that he's Professor Emeritus at the KidZ HealthCastle at the University Hospital in Brussels in Belgium. His main interests are functional gastrointestinal disorders, and he's the chair of the International CoMiSS Expert Consensus Panel since 2014. He has authored over 500 publications listed in PubMed and presented over 1,000 talks at the diverse international meetings. So without further ado, Professor Vandenplas.
So this webinar will be about CoMiSS and the role of CoMiSS to raise awareness of symptoms related to cow's milk. So you have heard in the first webinar about cow's milk allergy and the difficulties in diagnosing this disease. The first questions that raises is how prevalent is cow's milk allergy? Well, according to literature, there is a variation between 0.5 up to 3%. And cow's milk allergy is defined as a reproducible adverse reaction to one or more milk proteins mediated by IgE or non-IgE mechanisms. And as you heard, combinations of both are also possible. The cow's milk allergy prevalence is reported to be up to 3%, but is very variable depending on the country, region, and the diagnostic method used. So, for instance, if you are very strict in challenge-proven cow's milk allergy in Europe, then the prevalence is only about 0.6%. Luckily also, most children outgrow their allergy to milk in early childhood, depending on the initial presentation and severity of symptoms. So, prevalence of cow's milk allergy, depending on which literature you're looking at. Here, according to this paper, it's a prevalence between almost 2% and 5%. But if you use less strict criteria, then you can find data also in literature which indicate that there appears to be an increase in that prevalence of food allergies, with recent figures from some developed countries pointing towards a prevalence of 10%. But then, of course, it's not always challenge-proven cow's milk allergy. So the prevalence depends a lot also on the diagnostic method used. You heard in the first webinar about the different symptoms of cow's milk allergy, and they are summarized here again, with symptoms with IgE-mediated allergy and symptoms for non-IgE-mediated allergy. And they affect the respiratory tract, the gastrointestinal tract, the skin, and more general symptoms such as circulatory symptoms. You find it as well in IgE and non-IgE-mediated allergy, although the symptoms themselves might be slightly different. Striking is also the difference in timing between ingestion of cow's milk and the appearance of symptoms. For IgE-mediated allergy, it's minutes up to 1 to 2 hours, while for non-IgE-mediated allergy, it's hours to weeks. The age of onset can be any age. Mostly it's under the age of 1 year, and mostly it's within the 2 months after the introduction of cow's milk protein in the diet of the infant. Important also is the reproducibility of the symptoms. Symptoms should appear every time that the food is consumed in a substantial amount. What about the relation of atopic dermatitis and cow's milk allergy? Well, the more severe the atopic dermatitis is, the more severe the eczema, the higher the risk that the child will have cow's milk allergy. So in severe atopic eczema, there is about 1 child in 3 in which the eczema is related to cow's milk allergy. And if you then take it the other way around, children with cow's milk allergy, 40 to 50% of those infants will have atopic dermatitis, but certainly not every eczema is caused by cow's milk allergy. Diagnosis of IgE-mediated allergy is relatively easy because of the short time between ingestion of cow's milk protein and the appearance of symptoms. And we also have diagnostic testing there, skin prick test and IgE and specific rest, which will help to suspect the diagnosis of cow's milk allergy. It does not really help if negative, what is the case in most infants, so it has mainly a negative predictive value. What about non-IgE mediated allergy? As I already mentioned, symptoms are aspecific. There is no specific diagnostic test, and there is a huge time frame between ingestion of cow's milk protein and the appearance of symptoms can be days. However, according to the EuroPreval study, which is the best study on cow's milk protein allergy we have in European infants, it's about 1 infant in 4 which will present with non-IgE mediated cow's milk allergy. And here there is no real laboratory test that helps us to diagnose non-IgE mediated cow's milk allergy, and because of the lapse of time, it's all sometimes very difficult for the healthcare professional to suspect cow's milk allergy as causing the symptoms. So with the ESPGHAN, European Society of Pediatric Gastroenterology, Hepatology and Nutrition, we just published a new position paper on diagnosis, management and prevention of cow's milk allergy. And we said that for IgE-mediated allergy, the response to the diagnostic elimination diet is to be expected in 1 to 2 weeks, while in non-IgE-mediated allergy, that response takes also longer, 2 to 4 weeks. But so the diagnostic elimination diet is elimination of cow's milk protein from the diet, which should make the symptoms disappear. But so different duration of that elimination diet, or to see effect of that elimination diet according to the mechanism behind it. Because of the difficulties in diagnosing non-IgE mediated allergy, we developed with a group of experts, of which you saw the picture at the introduction of this webinar. We developed the CoMiSS, the cow's milk related symptoms score, which is an awareness tool to help healthcare professionals to consider that that infant with those symptoms may in fact suffer from cow's milk allergy. Which are the symptoms that are considered in that CoMiSS score? We will not go really into detail, but regurgitation and general symptoms such as crying are considered, and there is a different scoring according to the severity of the regurgitation, going from 0 to 6, and a different scoring for the severity or the duration of the crying, also going from 0 to 6. Stools are also part of the CoMiSS, and we use now the BITS, the Brussels Infant and Toddler Stool Scale, because this is a validated stool scale which is adapted to non-toilet trained children. So it's a stool scale based on stools produced by infants in diapers. Also, consistency is evaluated with a scoring that scores between 0 and 6, as you can see on the right part of this slide. And then skin manifestations are as well considered in an easy way, graduating, increasing the score by the severity or the extension of that atopic eczema, going for head and neck and trunk and arms and hands and legs and feet from 0 to 3. So in fact also up from 0 to 6. There is also urticaria and angioedema, which are considered with 6 as scoring if one of those two symptoms are present. And important to know also is that worsening of eczema when cow's milk protein was introduced in the diet may be indicative of cow's milk allergy. Respiratory symptoms are also considered, but to a lesser extent, because some infants with cow's milk allergy may present respiratory symptoms such as chronic cough, runny nose, and wheezing. But of course, most of the time, these are caused by also viral infections. So that's why respiratory symptoms are part of the score, but less important than the other manifestations. So the CoMiSS scores goes from 0 up to 33. And when we reviewed the extensive literature of all clinical trials that have been performed up to now with the CoMiSS score, it appeared that a total score of 10 or more may be suggestive of cow's milk related symptoms, and that a total score of less than 6 may indicate that the symptoms are not likely to be related to cow's milk allergy. So the CoMiSS scoring form is not intended to be used as a diagnostic tool and should not replace the only gold standard diagnostic tool, which is the oral food challenge. So cow's milk allergy diagnosis should be confirmed by a 2 to 4 weeks elimination diet, followed by an oral food challenge. So what you can notice is that most of the infants with non-IgE mediated allergy present with a combination of symptoms. And in fact, according to this paper, less than 1% of the infants with non-IgE mediated cow's milk allergy present with only one symptom. And that's why the CoMiSS score, which summarizes all those different manifestations, scores them for their severity, can be used as an awareness tool. I would like to repeat that CoMiSS cannot be considered as a standalone cow's milk allergy diagnostic tool, but that it was a useful awareness tool for cow's milk allergy, as well as for monitoring symptom improvement. Because a decrease of CoMiSS score during a cow's milk elimination diet was also predictive of seeing a reaction to the oral food challenge. So it's not only the cause, the score at presentation of symptoms, but also the efficacy of the elimination diet, which makes the score decrease, which can be indicative for cow's milk allergy. So we reviewed recently the literature, and as I already mentioned, the original CoMiSS was the cutoff was put at 12 or more, but according to the experience acquired by different authors doing clinical trials with using the CoMiSS, we decided to decrease the cutoff score to 10 or above. And also new is that a low score of less than 6 is not indicative at all for cow's milk allergy related symptoms. And this slide illustrates very nicely the decrease of skin scoring, respiratory symptom scorings, and the total cow's milk related symptom score on that diagnostic elimination diet, and how the score significantly decreases if there is cow's milk allergy confirmed by the oral food challenge, but the high score at the beginning, at the basis, and then at the end of the elimination diet, a much lower score. So in this trial, which was performed in China, the baseline CoMiSS score fell from 8 to 5. And in this study, also a high CoMiSS of 12 or more at a very high specificity of almost 90%. So I would like to repeat that in the position paper of the ESPGHAN, the oral food challenge is clearly positioned as the diagnostic method for cow's milk protein allergy, and that CoMiSS is only used as an awareness tool and not as a diagnostic tool. So diagnosis of cow's milk allergy needs an elimination diet of 1 to 4 weeks, depending on its IgE or non-IgE mediated allergy, and followed by reintroduction of cow's milk protein in breastfed infants in the mother, and challenge with formula feeding in formula-fed infants. So the baseline cow's milk related symptom score and its reduction during an elimination diet may be indicative for cow's milk allergy, but is not diagnostic. This is clearly a statement that has been accepted and published in our ESPGHAN position paper. So while CoMiSS might increase awareness and thus maybe favor overdiagnosis, it might as well decrease overdiagnosis, since symptoms are needed in at least 2 organ systems. And it's very well known that a lot of healthcare professionals consider constipation as single symptom, or reflux as single symptom, or crying as single symptom, as possibly caused by cow's milk allergy. So if you use CoMiSS, the use or the idea that one single manifestation could be caused by cow's milk allergy is certainly decreased and eliminated. And what this slide illustrates is that by using an awareness tool in the UK to improve the awareness of healthcare professional of cow's milk allergy, that indeed the black full line, the use of therapeutic elimination diets, formulas without cow's milk protein increases. But that is at the same time related to a significant decrease in use of medication. So by increasing the awareness of cow's milk allergy, you probably put more children on the appropriate diet, and the use of useless medication is significantly decreased. That brings me to summary. Cow's milk allergy is a complex disease. It's in increasing frequency. Its reported prevalence is 0.5 to 3%. It can be divided in IgE and non-IgE mediated or mixed forms. Most children outgrow cow's milk allergy in early childhood, especially in the non-IgE mediated allergy. IgE is usually rapid in onset and relatively easy to diagnose with tools available to support the diagnosis. While non-IgE mediated allergy can be delayed, the diagnosis can be delayed and is also dose dependent, and it is difficult to diagnose with lack of supportive tools. consequently, awareness of the symptoms is not always known, with cow's milk allergy being misdiagnosed, both over and under diagnosis, having consequences for the children, as you already heard also. So CoMiSS has been developed and designed to support the diagnosis of cow's milk allergy and to raise awareness. It reduces probably the risk for under and overdiagnosis. CoMiSS was recently updated, and it remains a very simple, easy, fast, non-invasive tool used to support the diagnosis of cow's milk allergy in infants. But again, it's not the diagnostic tool. It's elimination diet and challenge test, which is the diagnostic tool. But use of CoMiSS will probably improve the exactness of the diagnosis of cow's milk allergy, will improve the selection of infants suffering from cow's milk allergy, and so improve the health outcome of those allergic infants. And with this last slide, I would like to thank you for your attention.
Wonderful. Yvan, that was really incredibly informative. And we already, thank you for this presentation. We already have a large number of questions from our audience about cow's milk protein allergy and the use of CoMiSS. So, the first question is really, how should a CoMiSS be used and by whom? Can parents use CoMiSS?
Well, that's a very good question, and it's a challenging question. I think that parents can use it, but the interpretation of the CoMiSS should be done by a healthcare professional. So, of course, everyone can find CoMiSS everywhere, and parents can fill in the score, but it's up to the healthcare professional to check the answers of the children, of the parents, sorry, regarding the severity of the symptoms, the extension of the eczema, the severity of the eczema. So the interpretation of CoMiSS should be in the hands of a healthcare professional, but the healthcare professional can also give the CoMiSS to the parents while they're in the waiting room in order to get their opinion about it.
No, I think this is very clear. And then, if you have a suspicion of cow's milk allergy, as you mentioned before, diagnostic elimination diet is important. So the question was, how long should the breastfeeding mother avoid milk in her own diet, during that period?
Yeah, well, again, a good question. And I think that whether it's a formula-fed infant or a breastfed infant, the diagnostic elimination diet should probably be the same duration, which means up to 4 weeks, considering non-IgE mediated allergy, which may be causing the symptoms.
Yeah, and I think it's always important to sort of raise awareness that when we are eliminating something, even from the maternal diet, we should supplement. So calcium, vitamin D, right? Like if even for such a short period, it may be very important.
Yes, absolutely. So I think that therefore, in a lot of circumstances, is help of a dietitian in that elimination diet is very important in order to reassure that the mother still gets a nutritionally completely adequate dietary intake, because the cow's milk out of the diet, okay, but it needs to be replaced with at least other foods which are nutritionally equally effective for the nutrition of the mother and consecutively the baby. And yes, calcium and vitamin D is certainly amongst these factors.
There's another question about breastfed babies compared to formula-fed babies in terms of the stool consistency in breastfed babies. Like, can you say as a blanket statement that stools are looser in breastfed babies versus formula-fed babies?
Yes, absolutely. I think although what happens with the new European, I would say, formulas with probiotics and prebiotics added to it, that stools of the formula-fed babies have become looser than years ago. Breastfed babies still have looser stools than formula-fed babies in general. We discussed about that when we developed CoMiSS and decided to not make two CoMiSS scores, one for breastfed babies and one for formula-fed babies, because then it becomes probably too complicated to be used. And that's again why interpretation of the CoMiSS score by a healthcare professional is very important, because loose stools in a breastfed babies or a formula fed babies may have a different clinical meaning.
And there's a question about the multiple food protein allergy. And how do you define it? And is there a minimal number of foods that have to be involved to call it a multiple food protein allergy? That's an interesting question. I'm not aware of any like hard rule, but in general, if there's more than two, I would call it multiple food protein allergy, right?
Yeah, right. Two or more, I would say.
Two or more, right? Yeah.
Once it's more than one, it's multiple. And I mean,
Yeah.
that's certainly not the intention of CoMiSS to cover this kind of difficult issues, because CoMiSS is really developed to raise awareness about cow's milk allergy and not about other allergic situations. So for those complicated children, I think CoMiSS has no active role to play in that situation, although you could imagine that once the diagnosis is made and the elimination diet started, is maybe a decrease of CoMiSS score can more or less score or evaluate the efficacy of the elimination diets.
So we all agree, and we're very aware of the potential for misdiagnosis of cow's milk protein allergy, and CoMiSS is very helpful. But the question is, what if an infant has symptoms other, than those mentioned in the CoMiSS, and then, would you say we can rule cow's milk allergy if they don't have symptoms that are included in CoMiSS?
Yes, that's a very good question, and that's again certainly a reason why CoMiSS is not a diagnostic tool, because anaphylaxis is not included in CoMiSS, and clearly some infants will present anaphylaxis as presenting symptom of cow's milk allergy. The same is true for infants with food protein-induced enterocolitis syndrome. They also have symptoms which are not included, and we voluntarily also did not want to include blood in the stools, because there the differential diagnosis in these young age children is so important. It can be cow's milk allergy, but it can be also many other severe conditions. So we thought if we include symptoms like blood in the stools in the CoMiSS score, it may take away the attention away from healthcare professional for other important differential diagnosis. So CoMiSS is really, in fact, intended for those infants who have a little bit of everything, but not very expressive symptoms and minor manifestations. But if you accumulate them, then you come up with a significant burden of symptoms, and that's the population which is intended for the CoMiSS to be used in.
You know, there's another question, Yvan, where, like, and you know, you're a gastroenterologist, but when would you consider checking for cow's milk specific IgE when, you know, there's a high CoMiSS score, or would it be based on the symptoms specifically, you know, immediate symptoms versus, you know, very delayed symptoms, etc.?
Well, I think if depends a little bit also on severity of symptoms and which kind of symptoms. Again, severely sick children, anaphylaxis, blood in the stools, you don't need CoMiSS score. But those children who regurgitate, who have a little bit of eczema, who have loose stools, hard stools, parents complain, and then the symptoms are not that severe that on itself you would not think of allergy being involved, and it's the combination of symptoms in different organ systems which makes the CoMiSS score of interest.
Well, there's so many more questions in the chat, and clearly suggest, you know, indicating that this is a very important topic. Maybe if we those questions that we were unable to answer because of the time limitation, that, you know, you could send them to us. You know, I want to thank Professor Vandenplas for such a fantastic lecture, and all of you in the audience for active participation. Please complete the feedback form posted in the chat. You could also download the CoMiSS and the user guide on the QR codes in the final slides that will be provided for you shortly. We are nearing a 10-year anniversary of CoMiSS. There will be more opportunities to raise awareness of that tool. And thank you all for participating and being involved or invested in the best care for infants with cow's milk protein allergy. Thank you.